It could be a catastrophe. Health Minister Dr. Christopher Tufton on the possibility of a dengue outbreak in Jamaica. So far, there has been one suspected case resulting in a fatality in Trelawny. The Health Ministry has since intensified vector control measures in the parish. TVJ's Kalisha Williams reports.
With dengue fever suspected in Trelawny, the Health Ministry is not taking any chances. On Friday, a team visited the community of Hague in the parish. It's an initiative to eradicate mosquito breeding sites across Trelawny.
This issue of vector management and vector control is a serious issue. It can affect all of us. God forbid a virus that is more potent or deadly and have 80% of your population being affected. It could be a catastrophe. And so we don't take it lightly.
Health Minister Dr. Christopher Tufton was comparing dengue fever, which is deemed even more deadly, to the chikungunya virus, which affected close to 80% of Jamaicans in 2014. Both diseases are spread by the Aedes aegypti mosquito. Dr. Tufton says that mosquito population has since been on the decline, but still, the ministry is not taking any chances.
The decline is attributable to a number of things. I mean, clearly we haven't had a lot of rain, but we have a lot of stored water because of the drought, and that counter the lack of rain and therefore creates some additional risk.
He pointed out that 500 temporary workers have been employed to carry out vector control in different sections of the island. But the public is being urged to take the necessary actions to prevent an outbreak of dengue fever.
The householders should be in a position now to be very aware of what is needed, what is to be done, because part of it is not just our effort, but also that they have their part to play also. Because when we would have educated, then for the maintenance, they're the ones who are supposed to continue the preventative measures.
Kalisha Williams, TVJ News.